can be comorbidity, and sometimes it can be a sort of hybrid disorder, combining both. And this is what Tom Burney and others call a pathology porridge. So in actual clinical practice, as opposed to research, when you see a person with an autistic spectrum disorder, you have the core components there, but more often than not, they will also have other developmental disabilities and comorbid axis 1 disorders, either a mood disorder, a psychosis, or obsessive compulsive disorders. And if you think about the mood disorders, it is the full set of depression, anxiety, with a particular focus on anxiety-related disorders. And it is because of the limited social reserve that people with autistic spectrum disorders have. Anxiety becomes a pathological symptom. So when there is an overload of anxiety, they go into panic mode and often act out in violent ways. And this is important for clinicians in routine psychiatric practice, because when the end result is that is often, and it is associated with strangeness in interactions. These people are often interpreted as having psychotic illnesses and treated with antipsychotics. And because they have very limited neurological reserve, you give them antipsychotics, they tend to get akathisic symptoms very quickly. And when you see akathisia, it is interpreted as agitation is getting worse, and so they get even more antipsychotics. And you get into a vicious cycle if you don't get the diagnosis right. So this is emphasizing that point a bit more about why would autistic spectrum be confused with schizophrenia. A psychotic episode, one may make a diagnosis of psychosis when in reality it is an adjustment disorder or an acute reaction to stress in someone with autism. One may make a diagnosis of simple schizophrenia according to ICD-10 or 9 or its equivalent categories. And simple schizophrenia in DSM categories is closer to the schizotypal disorders, when it is actually a late onset of autistic spectrum disorder. And sometimes you say intractable schizophrenia when it is unrecognized autistic spectrum disorder. And why would you say that? Because what we interpret sometimes as hallucinations may be the ASD equivalent of concrete thinking. And what we see as emotional incongruity may be the different perspective and descriptions that ASD individuals do. And relative passivity and poor language of ASDs is interpreted as emotional blunting of schizophrenia. And paranoia can be social isolation. The take-home point really is autistic spectrum disorders may not predispose to schizophrenia, but it's definitely not protective against schizophrenia either. So you really have to be aware of both diagnoses and rule one or the other out. This is carrying on from Conor Duggan's presentation on personality disorders. And cluster A, the odd and eccentric cluster, overlaps with autistic spectrum disorder. So does anxious avoidant. But the really interesting cluster is flamboyant, the antisocial and borderline personality disorders. And why might autistic spectrum disorders be confused with BPD? It is because those four things are common in autistic spectrum disorders under stress as well. And those are criteria for borderline personality disorders. So again, it's a question of being aware of that and being careful with the diagnostic process. Skip that thing. And this is the process of screening for diagnosis. It's complicated by a number of difficulties, as you have heard. And this is a 10-item questionnaire that is available freely online, and you have access to these slides should you want it. The advantage of this is, in 10 simple questions, it erases your awareness and the carer's awareness of what you're looking for. And some of those items, like is the patient odd and eccentric, is he rigid, occupied by rituals, and so on, items 2 to 6, really helps you tease out a core psychotic illness from a core developmental illness. And the other useful instrument that the college has published and is freely available online is the diagnostic interview guide with areas of assessment. And this, once again, is available online, and anyone can access it. And there is a series of around 12 video clips that give you step-by-step instructions on how to do the interview process properly. So that again is freely available online. Interventions and management. I work in an inpatient setting for people who have got into trouble with the law. But even otherwise, what is described as the spell approach is a cornerstone of management. What you need is structure, a positive approach, low arousal, and links with other professionals. So it isn't, structure and predictability is the core therapeutic intervention. So you don't need a hospital for that. Because these people are routine bound and value structure and predictability, what you and I would find boring is not boring for them if you can enforce that structure. And the pharmacological approach would be to treat the comorbid condition. So there is no pharmacological agent which is particularly effective for the core symptoms of autism, but you carefully look at comorbidity. Psychological interventions, I left there. And so overall, it's a 4-stage process. Initially, you do assessment and motivational work. You clarify the diagnosis. You attempt a formulation. You do risk, that is if you are in inpatient settings. And then you do the pharmacotherapy or the psychological therapies. And that component, education, skills acquisition, and occupation, which paradoxically is rather easier in non-Western cultures because of the centrality of the family and friends in the scheme of things. And then you keep doing that over and over and over again. This again is if we are talking about people who are currently locked up in hospital, what would be relevant for you. And then you work towards discharge and transition. The most up-to-date intervention guidelines, again freely available. You heard a lot about NICE earlier during talks. This is freely available online, and it takes you through diagnosis and management of people within the spectrum. That's a whistle-stop tour of what I had to say. Thank you very much for your